So we'll maybe wait and see whether we get any people coming in the audience. So we might just give a couple of minutes to see whether people join us. We have a few people, I think, in the audience now. Welcome to the session. This is the session 1.4 on aging. I think we may be having a few technical issues. So we only have one speaker at the moment, and that's I think the fifth presentation in the program, which is Qiyin. But we're going to wait just a few more minutes and see whether any, just for other people to join us. I'll share the opening slide so that we can thank our sponsors. Okay, so we need to acknowledge and thank the sponsors for the conference and also the conference organisers who've done such an amazing job of setting this all up. I'm Jo Thompson-Kuhn. I'm the editor and co-chair of the Aging Group of Campbell. I'm based at the University of Exeter in the UK. So we're going to start off with our first presentation, which is actually the fifth one on the on your program. So Qiyin, do you want to start, share your screen and give your presentation? Thank you.
Okay.
Okay.
Okay, can you screen?
Welcome. If you'd like to introduce yourself and your topic and give your presentation. Thank you very much.
Okay. Can you hear me?
Yes, we can.
Okay. Good morning, teachers and colleagues. I'm Luo Qiyin from the Evidence-Based Social Science Research Center, Health Technology Assessment Center, School of Public Health of Lanzhou University. I'm very pleased to share my study with you at the What Works Global Summit 2022. I'm going to share with you the effect of community intervention on medication compliance of elderly patients with chronic diseases living alone, a systematic review. So why we did this study? According to the China Health and Retirement Longitudinal Study, the prevalence of chronic diseases among the elderly over 60 years old in China is more than 60%. Many chronic diseases are difficult to control and need long-term or lifelong medication. Compliance was defined as the extent to which a person's behavior coincides with medical or health advice. Poor advice includes behaviors such as not buying and refilling medications according to prescription, addition or reduction of medications at will, not taking medications on time or missing medications, and stopping medications without permission. A study showed that 60% of community-dwelling older adults take 5 or more different medications, but have poor medication adherence. The non-adherence rate range from 30% to 50% in developed countries and more than 60% in China. A cohabitant can supervise and remind elderly patients to take their medications, but elderly people living alone have no cohabitant. So community workers play an important role to support medication adherence among older patients. So how we did this study? We searched the records from Web of Science, Campbell, Cochrane, EBSCO, PubMed, Embase, and CNKI electronic databases without the restriction of language, and the reference list of eligible studies and relevant reviews were searched manually. The inclusion and exclusion criteria was based on Pico's principle. P is elderly patients with chronic diseases living alone. I is community intervention. C is general intervention, and O is medication adherence rate. All the included studies were selected and coded by 2 independent reviewers, and any disagreement was consulted by a third reviewer. Well, what's the intervention? Finally, we included 7 studies, 6 RCTs, and 1 quasi-experimental cross-sectional study. The disease mainly included hypertension and diabetes. So, first, they established the health records of each elderly patient living alone, which included their health status and medication use. Second, they hold health lectures regularly, ranging from 1 to 4 times a month. Third, some researchers conducted regular follow-up visits, either by telephone or face-to-face at home, to know about the medication use of elderly patients living alone, usually 1 to 2 times a week. Besides, some researchers made reminder cards with detailed instructions on what and how to take each day. The intervention group adopted the community interventions, while the control group adopted the general interventions. We didn't perform a meta-analysis because of the difference in the studies, such as different adherence rating scales and outcome measurements. Based on the results of the included studies, all 7 studies compared medication adherence rates between the control and intervention groups after the intervention, showing that community interventions improved medication adherence in elderly chronic diseases patients living alone compared to general interventions. And 4 of the studies also compared medication adherence in the intervention group before and after the intervention. And it was also evident that the community intervention improved their medication compliance. So in summary, community intervention can improve the medication compliance of elderly patients with chronic diseases living alone and should be promoted. The above is what I shared with you today. If you have any questions about this research, please contact me through this email. Thank you.
I think you may be on mute. Hello?
Hello. Hello.
Did you hear the question? No? I asked what you thought the main messages were for clinicians from your review. Okay. Maybe we should move. I'm not sure if we've got some technical issues. I'm not sure whether you can hear me. Should we move to the next presentation? Okay. So have we got, I think that, have we got Xiaoyun, who is presentation number 2? Are they? I don't see them on the in the presenters section, but I don't know if they're in the audience. Maybe joined using a different link. If we don't, then we could move to Jinglin, who I can see. Do you have your slides ready to share?
You show the slides with me?
It's quite difficult for me to share them just because of the setup on the system, but I can do it. It's probably easier if you're able to do it.
I can share the, let's see, how can share it?
At the bottom of the screen in the grey bar, it says share screen. If you press on that.
Go to let's see how to.
Can you see the button that says share screen?
The share screen, I can click. I will click share screen.
Yes, if you click that one.
Okay.
And then what happens? And then you just choose the window that you want to share. So you should be able to see the slides on your computer. Okay. So if I
that is not my presentation.
Okay. So when you press share screen, there should be some options along the top. One is the whole window, I think, and then one is the you can choose which window that you want to share.
I'm sorry. I don't know how to do it.
So have you pressed share screen at the bottom?
Yes, I click it, and then how we can get my slides?
Okay. Okay.
No.
I think it's okay because we don't have. Okay.
This one okay? Can you see that?
No, I can't. I can.
No. Okay. But,
So did you press the share screen at the bottom of the in the grey bar at the bottom of your screen? And then you should just be able to choose which is the one with your slides on.
sorry, I missed the time, but I don't know how to do it.
Okay. So I don't know, I can ask for help from the organisers and hopefully they will come and help us. Thangjahao, do you have your slides ready?
Okay, I can read my presentation, it's okay?
So I can share your slides, but the problem is that I can only, I can't advance them. So it doesn't,
How can do it?
I can share,
Okay,
I can do, but I.
That's right. Okay, just do like, just help me to click it, okay?
Okay.
Okay, that's great. Sounds great. Because I don't know how to upload at this screen. Okay, so let's start, otherwise waste the time. Okay, this is okay, so I think somebody can see it. Okay, hello everybody. I'm so happy. My name is He Jinglin. I'm from the Red Leaf Group. That is the NGO and we are from the China. And also my co-authors is Wang Xiaoxuan. I'm so happy we can share the outcomes of our project. The project name is Promoting Life Quality and Healthy for Older Women through Employment, Participation, and Age-Friendly Supportive Environment in Community of Beijing. Next slide, please. And the background and the evidence, according to the 7th National Census, there are about 260 million people over 60 and about 19% of whole population. And 14% of population aged 65. And as you know, China is in the process of aging society and also dominated by the younger senior group they are with high education level and they have knowledge, experience, and skills. So there could be the great potential role, can play the great potential roles in community level. Another finds that home-based care is a majority mode for seniors care in China, as so-called 1973 means 90% of senior are home-based care, 7% are community support care, and 3% are institute-based care. Another evidence or background is about active aging framework from WHO in 2002. There are 3 pillars of a policy framework. One is participation, another one is health, the last one is security. So our project is focused on participation and health. Next one, please. And the contents of our project is to develop policy briefs. I'm so happy I saw the colleagues from Lanzhou University. So this policy brief development with cooperation with the Lanzhou University, UN Women, and other organizations. Second one, we establish a project team and the operational mechanism with cooperation with the university, scientific research institute, and other NGOs to integrate professional aspect into community services. Third one, we also training community volunteers. As I said, they are younger senior volunteers. They are energetic and also realize the helping, warming, and the caring for seniors concept. The last one, we conduct Right Live Happy Elderly workshops. That is, through those workshops and activities, the seniors gain a sense of belongings, fulfillment, meaningful, and happiness. Next one, please. And our experience from the project is promoting gender equality. Equality is very important. 4 main recommendations from our policy briefs. One is to strengthen multi-sector cooperation to create a social support environment. Second one, to adapt effective strategy to enhance the ability and the level of elderly women's economic participation. Third one, to improve the supporting environment and improve the quality of elderly women's social participation. Last one, we also focus on older people with special needs, such as handicapped and other special needs senior, to achieve the SDG goals, especially the slogan of Leave No One Behind. Next one, please. The second experience, we also try to expand the project impact and outputs through the project evaluation documents, collect the feelings and the experience of volunteers and also medias, such as the new media WeChat groups. We have different kind of WeChat groups. Also among the seniors, they have WeChat groups. So we share the information, photos, and the knowledge through the WeChat group. And also share the good practice through the conference or seminars. And as well as we also assist outstanding volunteer to apply for relevant awards to let more people their contributions, and also warm-hearted of volunteers. Okay, next slide. The last one, experience of how we conduct community activities under COVID-19 pandemic. As you know, during the past 3 years of COVID-19 pandemic, the number of the participants and the number of the activities have to be decreased. And although we have tried to online activity, but it's not suitable for all seniors. They are unable to use the online equipment or activities. So we try to organize activities by reducing the number of participants. And also we try to open the window and the doors to have the fresh air, and ask the participant to wear the mask. So we try our best to organize the activity, but it's really get influence of the COVID-19 pandemic. Lastly, we, together with the seniors, are looking forward to getting back to normal, to have more activities at the community level, like the more happy, more participation, more feeling of the belongings. So that is my presentation. Last one slide, please. So here I thanks to Canada Fund for Local Initiative for their financial support for our project and activity at community level. And thank you for your patience. And so sorry for with some time for upload the slides. Thank you for your patience. Thank you so much.
Lovely, thank you. And apologies from me for not being able to get your slides sorted as quickly as we could have done. I think it has worked, hopefully. So thank you. Well done for your patience.
Thank you for Joe. Thank you for your coordination. Okay.
Do we have any questions? I don't see anything in the live Q&A. If anybody has a question, you're welcome to put it into there. Or I think you can also raise your hand if you have a question. Okay. So can you tell me a little bit more about the activities? What things did you do? Hello?
Hello, I'm here.
Hello? Yeah, are you still there? Yeah. So could you tell us a little bit more about the activities? What activities did you do when you said you did community activities? What were they?
Okay, our activity at the community level, first activity, we training our volunteers. Those volunteers are not only the senior, as I mentioned, but they're really the key task force. And as well as we also have the younger volunteer to join our projects. And as well as the hospital staff, because we also try to strengthen our seniors' health perspectives. So this is one very important activity, training or employment the volunteers. Second one, we conducted activities. That means we conducted collective activities, not only the individual for one coaching or assist senior, but we also have collective activities. It's very popular and welcome by senior because they can learn something of the knowledge or skills. Not only that, but also they can interact with other seniors or volunteers. So they are so happy and lovely to participate in those activities. We also take pictures of them. This can useful for our show the best practice or best cases of either the volunteer or the very active seniors. Currently, we have those kind of activity because we get impact of the COVID-19 pandemic. So some activity as a planned, we cannot implement it. So we're planning to do it this year and next year. We hope that's why the last sentence, we hope we can back to normal, to have more activities, more interactive, activity with the seniors.
Lovely, thank you. It sounds like fascinating work. So thank you for your presentation. Do we have any other presenters for this session? Xiaoyun Zhao or Thangjahao? Are they around? I don't know if they're in the session.
How about other participation? How about others, speakers?
Yeah, I don't know where they are. So I don't. We do have some people in the audience, but I don't see the names of the presenters in the audience.
Maybe also they have some problem about this kind of
Yes.
equipment or online assessment. Yeah, probably. Yeah.
Yes, I do. I think the.
But I think it's really good chance to can communicate with Joe, with you. Can you introduce your work?
Okay.
So because currently it's just the two of us.
Well, there are some other people here. We just can't see them. Yeah, so I'm the co-chair and editor of the Aging Group in Campbell. And I'm also a Professor of Evidence Synthesis and Health Policy at the University of Exeter. So we have lots of fascinating reviews coming through the Campbell Library on ageing, and I would welcome anybody who's working on a systematic review to consider submitting a title registration form to Campbell for us to consider whether it would be a suitable topic for the library. Yes, if you're not familiar with Campbell, there's lots of support in terms of training and guidance. So yes, if you're working on systematic reviews, certainly something to consider. I'm not sure whether we have other presenters going to come. It's a shame because we have slides for a couple of other people.
Yeah, that's very important to do the systematic review, such as we do the policy briefs on gender from gender perspective. We also use this methodology to incorporate our policy briefs. That's very important because we cooperate with the Lanzhou University, and we really think it's very important. And also we would like to share our policy brief later on because we are on the finalizing process, cooperation with the Lanzhou University and also UN Women. So we would like to share later on, maybe later this year, at the end of this year or early next year, so we can share our policy briefs. This, I think, is very important, not only for China, maybe also share with other countries.
So your policy briefs, how do you produce those? Are they...
Yeah, the policy, the name of our policy briefs is on the, we do the systematic review evidence, provide policy recommendations on economic and the social participation of the old people. We also try to provide an important reference for national policy and the strategy. So I think we also collect some cases or best practice from other countries in our policy brief as a reference for China's status. So I think it's very important not only for China but also for other countries. So it's
lovely.
Good to share in the future.
Thank you so much for contributing to the conference. I can see that Thangjahao is here. Did you want to try and share your slides, or would you like me to share them for you? Hello? Would you like me to share your slides for you? I'm not sure if you can hear me. Okay, does that work? Can you see the slide? I couldn't hear anything, so I shared the slide, but I couldn't hear. I don't know if you're having problems with your mic. Do you want to try? I think you're muted now. If I unmute you, if you try and speak and see if we can hear you. No, I don't hear. Would it?
Okay.
Hi, Xiaoyun. Are you ready to present?
Yes. Sorry.
Okay. Okay. Do you have your slides? Do you want them to share, or would you like me to share them?
Yes.
For me to share?
Yes.
Okay. Okay. Can you see those?
Yes.
You can see the slide. Can you see the slides?
Yes.
Unfortunately, I can't see you now, but I can do advancing the slides. If you can see the slides, and hopefully the audience can see the slides. If somebody could let me know that that's the situation, then we can start. Can you see the slides?
Yes, I can.
Okay. So
Yes.
welcome. Welcome. Would
Yes.
you like to introduce yourself and give your presentation?
My name is Jinglin He of Chinese medicine.
I think there's some problems with your sound. I'm not hearing very well. Okay, I think there was some problems with your sound. Did you want to try, maybe if we turn our cameras off, that will help. Okay.
Okay. Can see.
Okay. So that we maybe it would be better if, okay, you're getting to the right page, that's great.
Yeah.
Could you put it on slide mode? Like slideshow? Fabulous. Okay.
Okay. Can I start?
Start again, yeah, okay.
Okay. Sorry. Good morning, dear friends from academic. I'm very lucky to have the opportunity to attend this meeting. My name is Zhao. I am a graduate student at the Gansu University of Chinese Medicine, Lanzhou, China. Next, I will present to my academic presentation. My topic is the bibliometric analysis of artificial intelligence for the elderly at home. I will present to you my research from three aspects. First, with a background introduction. Second, with the bibliometric results, and brief conclusion. With the progress of technology, the elderly are gradually living longer, and the world is about to usher in age. How to provide security for the life of the elderly is a common concept in the world. Smart homes, which can assist the elderly in their daily life, solution problems. Maybe the best solution to these problems. The smart home was first proposed by the American Association of Builders in 1984. It was defined as a house with interactive technology. At present, the rapid development of artificial intelligence and the Internet of Things makes intelligent and digital internet design possible. The picture shows studies were published between 1997 and 2022. It can be seen that scientific research on the use of smart homes by the elderly has shown obvious growth trend since 2009. The broad line shows the average set issues per year of articles from 1997 and 2022. A total of 6,275 authors participated in the publication of 1607 papers. In the type, we ranked by total leak stress. The top three authors were Koch-Dj, Rashid Demirezji. The authorship network might suggest a of 6 collaboration groups. The top 3 journals with more publications are CSIR's Triple Access Journal of Better Intelligence and Smart Environments. We can find keyword the color group below the Internet of Things artificial intelligence healthcare networks and data city living indicates the scopes of smartphones. Wearable technology, physical activity force risk privatization balance illustrates that wearable technologies devices can help older adults manage violence and also monitor physical and mental health while they perform activities and exercises. Class 4. The color is yellow. Keywords include activity recognition, system sensors for detection, deep learning, classification further shows that these intelligent system sensor devices can identify and predict the risk of force so as to better protect the elderly. In the treated topical picture, the results show that the most common themes in the early days were system, dementia, sensor, ambient intelligence, monitor technology, etc. While the most common themes recently were self-efficacy, the Internet of Things, mobile, Internet privacy, and older adults. Currently, smart homes are being used more in medical care, and devices can continuously monitor the health status of the elderly. The application technology of many intelligent systems is developing rapidly. In the future, smart home will be more and more applied to the daily life of our elderly. Their quality of life and independence will be improved. In a word, in the first among aging society. Smart homes such hotspots in the future. Thank you very much, and that is the end of my speech. Thank you. Thank you, Krista.
Thank you very much. It's a very clear presentation. Do you want to stop sharing your screen now, and then if we have any questions from the audience, please add them into the live Q&A box. I know that the live Q&A box is working because there were several comments about not being able to see the slides. So does anybody have any questions for Xiaoyun? No.
Yeah.
So I can ask you a question. What surprised you most about the research that you did?
Oh yeah. I think 就是 I think why
Hello?
so
What surprised you most
sorry?
about what surprised you most about the research that you did?
No. So my network is not good. I did hear your questions clearly. So
Okay.
I hope we can contact by email. Can.
Okay. Thank you. Thank you very much for your contribution.
Thank you. Thank you, Krista.
Okay.
You can invite the next speakers, Krista. Thank you.
Okay. Thank you. Okay.
Thank you.
Thangjahao, do you want to try again with your sound?
Yes.
Can
you?
Okay. I can. Fantastic. So do you want to share your slides, or would you like me to share them? Hello, I can hear you. Would you like to share your slides?
My slide, ma'am.
Okay.
Yeah, please share my slides.
Okay, let's see if I can do that. So, can you see your slides now? Can you see your slides?
No, ma'am.
No? Okay. So, hang on. Let me see what I can do. So, if I share the screen, and I want to share this one, share, and you don't want to see me. And then if I go here,
Yeah.
okay. So now can you see them? Yeah, is that working? Okay, fabulous. So welcome.
Sure.
Yeah, please give your presentation, and if you let me know, I'll advance the slides when you're ready.
Yeah. Thank you, ma'am. Hi. My presentation title is Trends of Aging Medical Population in Northeast India, and my name is Thangjahao Haokip, PhD Development Studies, Institute for Social and Economic Change, Bangalore. Yeah. Next. Is for your information, India, eastern part of India, it comprises states. It has a rock topography, a hilly terrain area, compared to other part country. The population was density was 17 kilometer in all at the it was 368 square kilometer, and the trend 2021 trends of aging I have done, and economic will be group to years and 60 plus years also. In India, is group of 50 years are economically active population. So the other into below and 60 are dependent population. And since they are most of the plus at 60, most of the workers are retired. And the age dependency ratio is determined by the our population 1961 to 2011 in India have and in 2000 0.6% was the dependency dependent use. Next slide, please. My objective source of data to study the trends of aging and dependent population in India, and sources are from National Commission on Population for West to census study due to COVID-19 in this projection population, and that I cannot in this not to the whole understand reason. That's why for the primary data collection during September 2019, I have census with the information. I have used tools like percentage and growth rate or dependency ratio. Next slide. From the growth rate of population 1 to 2020 and all India levels compare. In 2001 to 2011, between this decade, the growth rate is more or less similar with the national level. In 2021, according to the projected population also similar. It's lower in the northeastern region, even though the population density is more bigger in the for India level, and the population distribution. The population distribution also by age group. The population 0 to 14 years and 15 to 59 years and 60 plus years. It's very much a bit slower in the northeastern region as compared to the national level, 60 plus years. 0 to 14 years decrease due to the rate and mortality rate, and mortality rate decline due to the better availability of health services, but which is more in the India level, but western region health facilities, and 60 increase with better health facility. However, in no region has increased half of the national average. The dependency ratio children and age people are not meet their economic needs by their own. That's why they are dependent. And the dependency ratio and or age, the or age half of the national average in northern region is right. As for the primary data distribution of population, the total dependency ratio was 8%, and the child 50 and or age percentage was 28. Most of this or age plus are still the main work. During the last 2 decades, the fertility rate and mortality rate has risen, and it's also found by the this is similar declining rate of child dependent and the rate of decline of elderly dependent much more lower in the northeastern region. It's health center and primary health center. The northeastern has geographical area. Its health center has covered as compared to the other part of the northeastern. The other health and family welfare doing report. So if the health center better, this the declining or mortality higher or better in the future. And in the northeastern region, the total dependency has declined, but its dependency has increased, which is not similar with the national level. And as per the primary data in Manipur, a significant proportion past year's population were still working as a breadwinner in their family. It was due to mixed status and lack of employment opportunity for their Thank you.
Thank you. That was a very clear presentation. Thank you very much. Do we have any questions from the audience? I don't see any questions in the live Q&A yet. Okay, so can I ask you a question? What do you plan to do next with this, your research?
Yes, ma'am. This paper to publish presently for this, and as far regarding this, it is not much related to hypothesis, but as out of interest, I am doing this.
Oh, okay. So it's an extra, not part of your PhD. Okay. What's your PhD about? Is that also related to aging?
Infrastructure and human development in Northeast India. That was my. But I add some in the part of human development, like income and in those areas, varying between old age population in their main occupation.
Okay, thank you. Any other questions from our audience? I don't see any in the chat. And I think that is all of our presentations for today. So I'd like to thank all of our presenters. You've all done a fabulous job with the challenges of the technology, and which has not been simple, has it? And I'm sure it's like different times of day wherever you are. Hopefully it's not the middle of the night for anybody, but it's probably not as civilized a time as we have here in the UK, where it's about 11:30 in the morning. So thank you all for your contributions to the conference. I have a final slide, which is just to remind you about all the other things that are going on. Here we are. I think I can't do it. Here. So there's lots of other activities. We're kind of at the start of the conference, so please take time to check out what else is happening, and also to tweet. I understand there is a prize for the tweet with most engagement, so please do tweet and use the hashtag, which is WWGS 2022. Thank you very much. I'm going to end the session now, unless we have any other questions from anybody. Yes, we have a comment in the chat. Thank you to the presenters. So thank you all, and thank you also to the audience for coming along. Okay, thank you.
Okay, thank you.
Thank you.
Bye.
Thank you. Bye-bye.
Bye.